Well, our next guest has answers to questions I need to ask. Like, I have so many questions about the airway, about oxygen, about sleep, about breathing, about dentists, and how all those things are somehow related together. Our guest is Dr. Kalli Hale. She's an advocate for the connection between this dental health and overall well-being. She's also she's got a great podcast that I got to listen to called the Sleep Well Journey. It focuses on her transition from the traditional dentistry and focusing on, sleep and wellness and all of the above. And her content on mouth structure is like literally blowing my mind right now. So you and I, we're going to learn together as she educates all of us. Kalli, welcome to the show.
Thank you so much for having me. This is going to be a great time, and I hope to provide so many answers to questions you've had, it sounds like, for a while.
Oh, no doubt, no doubt. And I think, I think just at the top, this podcast is always about this like connection, mind, body, spirit. Like we understand that the concept of being created, and you've got these like venturing back into the way we were designed to live and all these different things as it relates to lifestyle, health, wellness. But like dentistry feels like this like foreign thing it's like one of the final frontiers for me. I don't know for everybody else, but you do a lot of work with airway. You do a lot of work with sleep. I've read some of these books around oxygen and sleep. So let's just start with sleep and go from there. Why is sleep so important? And how could like a dentist possibly have anything to do with sleep? I thought they just kept me from getting cavities.
Yeah, it's just wild, like to think that we hold such an important role in the sleep journey for a patient when it was never part of our specific training in dental school. I mean, I got out ready to fill teeth and do crowns and make beautiful smiles. And the only thing we learned about sleep apnea was that if you were obese, you had it. I mean, that was really the extent of it. And fast forwarding over a decade to realize that we are literally the most important step for a child's growth and development early on, starting at age 3, was wild for me because it just, once I saw it and learned it, and the things I'm going to tell you today, like once you see it, you can't unsee it. And it will totally change the way you look at your family members and your kids and yourself in analyzing, did I have orthodontics done properly? AKA, am I a nose breather? So there's just so much that we can start with that. And for me, I got out of school and was told basically by the entire pediatric department in dental school that if a child was snoring, that was normal and they would grow out of it. So I said that. I told that to so many parents, it makes me want to pull my hair out because it's just, I paid a lot of money for my education. I was in school for decades. Like to get out, you just are ready to go provide education and care to your patients. And to know that I said that now is really, really difficult. The other thing for me is that tooth extractions for braces, there's a couple of things for anybody listening that I just want to resonate with them, that if you're being told your child needs permanent teeth extracted for braces, you must get a second opinion. It is going to be a life-altering decision you make if you take their permanent teeth out for the sake of straight teeth. So yeah, there's lots of different rabbit holes we could go down today, but just know dentists are not trained enough in this. It takes an incredible amount of money and education after dental school to even be aware of this, and then to learn how to do it properly and to communicate well with your patients is a really, really big deal. So
yeah. Sorry. I was just going to say, what about you? How did you how were your eyes opened in all of this? Because you're opening our eyes right now. So how were yours?
So I come from a family of dentists. I'm married to a dentist. My sister's a dentist, and my parents met in dental school. So I grew up in dentistry, and my parents are just wonderful, wonderful people. My dad is about to retire now, and they have always just ingrained in us that you do whatever is best for the patient, period. Don't ever assume they can't afford it. Whatever you think is going to be the best for them that you would do for your brother, your sister, your dad, that's what you do for those patients. And I got out of school and I did a pretty extensive implant residency. My dad is a big time implant dentist. So he would just give people these beautiful smiles, and to see the transformations, just really affected me growing up. So I thought that's what I wanted to do. And then I would start having side effects, seeing things in patients that dentists see all the time, like you break your tooth or your crown chips, or you have an implant and maybe that crown has come loose or whatever has happened. And somewhere in there, we started hearing that it could be sleep related. Now, I mean, I didn't have my own sleep test machines. I didn't have physicians I was working with. Like, I just decided if some of these side effects that I was seeing all the time had a root cause, then I wanted to meddle in that a little bit and see if there was a way to fix it instead of, oh, here, pay me another $700 for a night guard or pay me for another crown or whatever. It's like, why are you grinding your teeth? This is adult stuff in the first place, right? And so I started sending patients to have a sleep study done, basically virtually. I would like send them to the website, they would get the sleep test and come back. And I was catching sleep apnea left and right. I was literally shocked. And then I was like, well, what the heck do I do? Because I don't know how to help you. And I just sent everybody to get a CPAP. I'm like, a CPAP is the only thing I knew that was the way that you treat sleep apnea, basically an air compressor on your face all night. And you got to lay on your back and it forces the air in.
Oof.
And while it is life-saving for sure, not a lot of people enjoy that. And the, overall retention rate of that therapy is pretty low. And as soon as it's under your bed, your heart attack risk goes right back up. So I just knew that wasn't a long-term solution for somebody, especially somebody in their 20s or 30s, but I didn't know any different. And I started doing more research, looking into education programs, and I started finding these dentists. It was like in a sea of like normal dentists. I'm like, oh, you do sleep. Like, hey, tell me about that. And they were all so like me in the regard of just like, oh my gosh, you're interested in it? Let me show you, because so many people need help. And I went and did a really extensive postdoctorate education in specifically obstructive sleep apnea. It cost me a lot of money and time and travel away from my family. But the pediatric part of what I learned, I actually went to that program for adults. I had no plan on treating kids. But what I learned is that you could prevent it from ever happening in the first place. And I was looking around the room like this, like, is anybody else as shocked to hear and see these cases as I am? Because I'm not that old, but like these guys have been doing this for a long time and we had no idea. So that was kind of like the tip of the iceberg for me. I did all that training and came back to the practice and was like, this is what I am put on this earth to do. We are going to save these kids. And yes, we're going to help the adults too, but I want to prevent a lifetime of sleep disordered breathing by starting when they're as young as 3. So that was kind of my background from, I was just filling teeth all day. Like, people liked it. It was good. I did very good work, but then I fell in love with orthodontics and sleep. And it's just been like an incredible journey for me.
That's amazing. Everyone has their like superhero origin story of how they sort of come to what they're passionate about. Okay, forgive me for being like so like unknowledgeable about everything
Totally
about
fine.
sleep, but I'm going to ask you, and I think a lot of people probably are too. So how does, like, just maybe a high level, like how does what you do affect like changing facial, like is it teeth structure? How does that actually and legitimately like I guess help with getting your airway? And now I could kind of like imagine, yes, my teeth are somehow in the way, or maybe my tonsils or jaw or whatever, but like how does that actually help?
Yeah. So your whole breathing complex is right here. So you have, luckily, 2 ways to get air in, your nose and your mouth. And thankfully we have 2, but there is one that is the most important way to get air in, and that is through your nose. You actually get more oxygen to your brain when you breathe through your nose than you do your mouth. And when you mouth breathe chronically, even it starts with like a little bit of mouth breathing when the kids are young, maybe a little bit of allergies, whatever, the tonsils and adenoids will get really irritated and inflamed and swollen. And then it's this cascade of like ear infections, and we've got to go to the ENT for tubes or to take the tonsils out. And nobody is understanding that the overall jaw development and the nasal passage width is not growing properly. So it's like, oh, we have large tonsils. Okay, let's just take them out, instead of, why did the tonsils get large in the first place? Like, maybe if we could fix the reason that they got large, they could go back to a normal size. And I have successfully treated hundreds and hundreds of kids with enlarged tonsils that are now normal sized, my son included, and spared them surgery because we got them to breathe through their nose. So that was a side note. But ultimately, the width of your upper and lower jaws determines everything. The roof of your mouth is the floor of your nose. If you look at your skull, your palate is the base of your nose. So if you have a really underdeveloped jaw, really underdeveloped child, which will manifest as snoring, tooth grinding, especially mouth breathing, and crooked teeth. You have really, really crooked teeth because your palate is so narrow, and therefore your nasal passages will be much smaller than they would be too. So when we go in and start having them wear an appliance like a tooth pillow, which helps them to breathe through their nose, and then put fixed upper and lower expanders in, we start changing that architecture and putting it back into a normal jaw shape with enough room for your tongue, which is really, really important. We haven't even talked about the tongue yet, but that tongue needs to be able to sit to the roof of the mouth and have enough room to fit. And that's what's going to change the shape of their face and ultimately the way they breathe as a grown-up.
So what are some of the sort of telltale signs of not getting enough oxygen, not getting enough air at night, or maybe even sleep disturbances? How do I know if me or maybe my partner are having sleep disturbances?
So for adults, I would say your partner's already going to be kicking you because you're snoring really loudly. The adult stuff to me is a little more obvious and kind of like easier for us to comprehend. The kids, not so much, especially when they're 8, 9, 10 years old, because they're not really sleeping with you anymore. So you don't have a good radar for, are they tossing and turning a lot? Red flag. Are they dealing with night sweats? Red flag. If their mouth is open or they're snoring, 100%, like that is not normal. It is just super common. Tooth grinding. Now, a lot of the parents that come to see me, they say they can hear their kid grinding from, another room. And that just like makes me so sad because that is like serious sleep disordered breathing problems. And so those are some of the things that you look for in your child. The other behaviorally is they will manifest fatigue differently than an adult. We can like get a cup of coffee, say we're tired, like struggle, but we can also like self-regulate, right? That behavior and that, because we're older, they can't. So the kids will act out. ADHD is a huge problem in kids that have sleep apnea. It is a huge problem. They should be, every single child that is about to be given that diagnosis formally should have a sleep study before anybody does anything else, because we're medicating our kids for being tired, and we've got to stop doing that. So there's a lot of different behavioral issues, hyperactivity, anger, fatigue, falling asleep in school, things like that nobody thinks to think about their dentist, unfortunately, right now when those things are happening. Yeah. But that's what we can change with podcasts like yours and mine, because we need to change the narrative around crooked teeth and the idea that braces or straight teeth is a privilege for the rich and it's just cosmetic. It is truly a medical issue that needs to be resolved while they're growing.
What percentage of kids would you say are going through something like this, if you had a guess, or maybe like they're actually having some sort of
upwards of 80 to 90% of our children.
Wow, really?
Yeah. And they say 80 million people have sleep disordered breathing or obstructive sleep apnea right now.
Wow. So for an adult, if they've got sleep apnea, is it too late to do some of this like mold shaping of the teeth?
So it's not, which is really exciting. Depends on how severe you are as to what treatment will work for you. I was able to undo a lot of orthodontic damage to myself to get this smile done because I did not have proper orthodontics, or airway orthodontics, I should say, in our generation, just because it wasn't as popular as it is now. But there is surgery, which is not fun, but necessary for some people that are really, really severe. And there are non-surgical options. There's also just a traditional snore guard that we can make in dentistry that just is like a retainer, and it gently holds your jaw forward like this and will help you to stop snoring. So for some people that maybe they don't want to change their teeth, or they have veneers and they've done all this beautiful work, whatever it is, and they don't want to do any changes like that, then we can make them something to make sure that their oxygen is good at night. Because the number one side effect of sleep apnea, unfortunately, is death. And that's what people need to understand. It is a cardiovascular issue. It is a heart attack or a stroke. And luckily, when they're little, that's not what we're seeing. But I know how these little kids are going to age. And the guy that's 55 that has a heart attack and nobody knows why, I've got my suspicions for sure.
So does like a lack of oxygen at night and maybe, sleep disturbances, waking up all the time, whatever, snoring, that's sort of what does that do? Does that raise your blood pressure? Is like ruins your heart rate variability? Like, is that,
absolutely.
How is that causing
Dude,
heart attack?
You nailed it. See, you know more about this than you think you do, I think. I mean, that's like nice. Our recovery is so important. So if you think about overall recovery for an adult, if you're exercising or whatever you're doing, your sleep and your rest is vital. You will not recover. Your weight gain will be higher, your cortisol will be higher, and then your insulin will spike. So those disturbances in sleep and those oxygen issues should never be happening. When your oxygen levels drop, you go into fight or flight mode. They don't know if like a car is chasing you. Your body doesn't know the difference between a car chasing you and the fact that you stopped breathing. I mean, it is a big deal as far as the inflammation in your body that happens when this happens. It serves no place in our lives. And if your partner snores, like they've got to get a sleep study, because you fall asleep eventually. So you don't know, are they gasping for air? Are they stopping breathing, or is it just snoring? And same with our kiddos. What we are finding neurologically that is literally, unfortunately, somewhat irreversible in our kids that stop breathing, it's why I'm so passionate about it, because they need to be resting and repairing and recovering from their day.
Wow. Yeah. I mean, obviously the oxygen is so important. It's your time for your brain to reach its full potential in recovery. But, I'll be honest, like, I'm like, okay, so if 89% of kids are going through this, it just makes me curious how many adults also might be going through some sort of version of sleep apnea, whether it's like severe or mild, I don't know. Would you recommend most people try a sleep study, or is that something you would just say like, oh, if you've got this symptom or that symptom? What would you say about that?
So I think the patients that are completely asymptomatic, which is very low, there's not very many people that won't tell me that they get up multiple times to pee, or that they wear a night guard or whatever. If you have no symptoms, then am I going to tell you, you really need to go get a sleep study? Like, probably not. But I'm going to use your teeth as a marker for whether or not I really press you to do it. So a sleep study is harmless. Like, everybody could go get one. It causes you like no harm. And I really do think that having a baseline sleep study at some point in your life is a pretty good idea. But if you're a patient of mine in my practice, if you're telling me, I sleep great, and I'm looking at your teeth and I'm seeing like a lot of crowns everywhere, maybe you've had root canals, you've got wear, you've ground them, like maybe you just don't realize how bad your sleep is because you've always slept that way. I mean, there's something to be said about that too. We have a normal for the way that we feel. And maybe we just think that's as good as it's going to get. I think trusting your airway dentist to look behind the curtain and really make sure that your body's not telling me something else, because that will influence how much I beg you to get the sleep test done.
Yeah, I feel like I need a sleep test now. I'm just telling you. But
Really?
I will, the way you're describing it, I'm like, what's the harm? At the very least, there's a baseline test done. But like, I think at least a few percentage points of what you've described, I'm like, I think I might have had that. I think I might have had that. I might have had that. And so why not? What harm could it be?
None.
Yeah. What about other things that help with a potential like oxygen? So like a couple of things that are really popular, like nasal strips or like mouth taping. Are those things like helpful, harmful? Are they more novel and they're kind of just like gimmicky? Like what do you think about this?
Yeah. So I love diving into all of those modalities because I get a lot of DMs about it. Like, should I try this? Should I do that? So let's take nasal strips first. I am the biggest fan of the intake breathing strips. And they are not paying me to say this. I freaking love those strips. When I work out in mine, they were made for athletes to start. And now they're like in the dental sleep world. Breathe Right strips don't hold a candle to these things. So I'm very picky about brand and the magnets with that band all day long. I've talked to them about coming out with a pediatric line, although they have a small that fit my 7-year-old daughter perfectly. So I buy them for my kids. You need it for your son. I already tell you that. It'd be great. Get them on Amazon and just get it sent.
All right.
And make sure that they have the best nasal breathing that they can at night, especially when they're symptomatic. No question. Lip tape. Okay. I don't tape kids. I think for fairly obvious reasons. We just have to be careful. I have recommended it for certain patients of mine that they're under my direct care. I've known them for a long time. They're nasal breathing fine, but it's not my go-to, like just slap tape on your kid's mouth. If their tonsils and adenoids are as bad as some of the ones that I see, like that's not going to help them because they need to breathe through their mouth until we fix it. For adults, I mean, lip taping can give you the best freaking sleep that you've ever had. Okay. Like you start taping and you will be like, oh my gosh, I'm rested. Now, here's the thing. I have literally talked to patients who have had horrible sleep apnea. They didn't know. They tried taping. One guy, literally true story, 2 weeks ago, woke up in a full-blown panic on the ground, hyperventilating as he ripped it off because his airway was so small that he almost offed himself. Like seriously,
oh my gosh.
It was like I don't even want to his oxygen levels got so low, even on his sleep
Wow.
study when he wasn't taping. So I can't imagine what happened that night. But so for adults, I always say, please have a sleep study first. Before you tape, just make sure you don't have sleep apnea. Because if you don't, then you can start retraining that nasal breathing. And it's awesome. But gotta be careful.
Oh wow, yeah. So I haven't had a sleep study, but I do the mouth tape, and I do have the magnetic nasal
Cool.
nasal. I guess not, I don't know if it's a strip or whatever it is, but man, when I do mouth tape and it doesn't fall off somehow on accident, it's like the best
Isn't
best
it?
night's sleep ever. It's like, oh my gosh, like this is what I feel like. I woke up as a teenager. You're
Yeah.
like 12 and you grow
Yes.
in your sleep, and I'm like, oh my gosh, like I feel great. So I would highly recommend all that, but.
Yeah.
Describe a sleep. What is a sleep study exactly? Is it is it just like measuring oxygen like throughout the sleep? Like what is it?
Yeah, so there are a variety of home sleep tests on the market, which is my ultimate recommendation for anybody getting screened, because you are in your comfort of your own bed. Everything's going to be a little more normal. The original way to do it was in lab, and you are hooked up to all of these leads. Somebody's staring at you all night while you're sleeping. Like, the number of people that have told me, like, well, I didn't sleep well anyway, I don't know what this thing says. Like, they just get frustrated. I'm like, yeah, I can understand that, because you're like in a hospital bed, basically. There's lots of different machines. The one that I use is a really large ring. It looks like a big ring on the top of your finger. And it was created by a cardiologist, and I get some incredible heart data from that. So it's not just pulse oximetry. They utilize something called cardiopulmonary coupling. So a heart lung coupling to come up with the data. So I get really awesome results from that. The home sleep tests, the other ones that are on the market, are also great. They tend to sometimes have like a waistband, maybe a headband to measure breathing and snoring. So there's a variety of them, but ultimately really comfortable to do it at home. And that's what I recommend. Yeah.
And do you do that just one night, or is there multiple nights?
I do 2 nights personally. I think multiple nights is a good idea. 2 to 3 nights probably. Just so in case you get one like weird night, you're not feeling like all the data is skewed,
Yeah. Well, I just feel like for me, oh no, all the pressure's on. I gotta have a great night's sleep right now,
Yeah.
or else it's gonna, the data's gonna be off. So 2 nights feels like. What about other things that measure? Is there anything tangible you can take from like a Whoop band or like an Aura
Oh my
ring,
gosh.
or any of those things?
Those things are so accurate. It's wild to me. Now, they can't be utilized to diagnose sleep apnea, but I bought Aura rings for everybody for Christmas. I was like, everybody got an Aura ring.
Here's mine right here.
Yeah, oh, sweet. And I love the cardiac component, the heart rate variability, and the sleep data that comes on there. I've compared some home sleep test machines to the Oura Ring and gotten very similar accurate data. The one thing that I have to look at as the doctor is the lowest oxygen, which no machine on the market, no consumer machine on the market will give you. And I think it's because people would panic if they saw how low their oxygen went. Now, the Oura Ring is great at giving you data on like spikes and changes and disturbances. But for diagnostic purposes, I obviously have to use mine, but those things are awesome. And I think have woken the population up to at least like, hey, I don't get great sleep. My sleep score is pretty low on average. Like, go talk to your doctor, and that's where they will hopefully find the right help.
Oh, that's good. Yeah. I mean, I've got an Oura Ring. I love it. It's great. I love all the data that comes with it. I have read some stuff about the HRV and it being like maybe inaccurate, but like that's just like anecdotal, people saying, I didn't think it was accurate, but maybe it's just people thinking I should have a higher one than it tells me I do, or something like that.
So it's hard because with the various consumer machines, like there's not a lot of, I would say, consistency of them being able to reliably figure out, is it accurate or not? The sleep study machine that I use, the big ring that I use, does have a very strong heart rate correlation to the Oura Ring and has been very similar. So I think those people are probably just upset that it's not high, because they might have sleep apnea and they don't know.
Yeah.
But it's pretty accurate, I would say. Yeah. So I've put patients into oral appliances to hold their jaw forward, like we were talking about, adults, like for sleeping, and their Oura Ring changes are incredible.
Really?
Like their HRV is way higher when they're wearing the appliance. Everything is better, their disturbances. And so that makes them a believer in what we do too, because you've got literally tangible data each night. And then if you don't use it one night, you see how bad you sleep. Like, it's obvious.
So are you dialed in on, you have to be dialed in on this all yourself. So what is your like protocol? You use the nasal strip, you have the
Yep.
Oura rings or anything
Yep,
else you
and the
do?
lip tape. Yeah.
Yeah.
So my personal journey, I had headgear as a teen in the wrong direction. They waited to do my braces until I was a teen, which is kind of what the norm has been, I think, for our generation over the last couple of decades. But what they don't realize is a girl's head and neck is 94% developed by 12. And a
Wow.
boy's is 90% developed by 12, which is why the under 12 is so important to treat. So for me, I had braces as a teen. My teeth weren't even straight. They wanted to pull my permanent teeth. Luckily, my parents said no, but they didn't know why they said no. They just didn't think that was the best option for me. And then when I was in dental school, because my teeth weren't straight, I was like, I should probably have straight teeth because I'm in dental school. I'm going to be a dentist. So they did braces on me, bracket wire braces, which I also don't love. Now that I know what I know, but they went in and sanded like in between all of my teeth. It's called interproximal reduction. So if you're in clear aligners like Invisalign or braces and they're sanding in between your teeth, it's because they think you don't have enough room for your teeth, right? Which just means that your palate's not wide enough and your jaws aren't wide enough. So it's not something that I advocate for. It's not a treatment that I do on patients unless it's for totally other reasons like cosmetic or something. So when I started giving all these patients like these huge smiles and doing all this stuff, I was like, it's my turn. Like it or not, Kalli, you've got to do it. And so I did, and the changes were just wild. But I had a super severe tongue tie. So we haven't talked about tongue ties much. They go missed very easily in medicine. Pediatricians aren't normally aware that they're a problem. Like a lot of parents are told that like if your child can eat and speak fine, like they don't matter, like don't do anything about it. And that's what my parents were told, even as dentists. And I never had any problems with speech. My dad said I come out of the womb talking. Like I've always just been this like vivacious, ready to go. And I never had any issues, with food or anything. Like it was fine. But what nobody realizes is that your tongue is your natural palate expander. So if you're super tongue tied and your tongue stays low, because it would be tied like down underneath, right? And it doesn't suction to the baby's palate as a baby and then a toddler and then your palate will not naturally expand like it was designed to.
Wow. I see
Then
what you're saying.
everybody needs braces. Everybody needs their wisdom teeth out. It's like this thing that we just keep doing because we aren't trying to figure out how to get all the teeth to fit in the first place.
Yeah. Right.
So I had my tongue tie corrected 2 years ago after I did all of my own expansion. And it was one of the best things I ever did for my neck. My neck tension and shoulder tension was wild.
Really?
And I mean, doing dentistry is kind of backbreaking anyway, but
Yeah, sure.
my neck would go out a couple times a year bad enough to cancel the schedule, which Kalli Hale does not cancel a schedule of patients, okay? Like that's just not a thing. And so I had it fixed and I mean, it was like crazy. Like if you saw me before, I couldn't open my mouth and lift my tongue up. I mean, it was like pretty crazy.
So your tongue is kind of just like sort of stuck below here and it's
Yes.
not able to go up. Does like breastfeeding as a baby have anything to do with any of this
Absolutely.
stuff? Okay.
And my mom nursed me fine, apparently. Like there was just like all the things that maybe would have, I don't know, gotten me in the right hands as a baby. Like I fix tongue ties on, 4 or 5 day old babies all the time because they can't nurse well or whatever. And every time I do it, I'm just like, you won't remember me. You don't know who I am, but like the rest of your life's going to be different because you won't make it to my age with a tongue tie. Yeah. Which is how it should be.
That's so cool. I love that.
Yeah.
I'm starting, as you're talking, I'm starting to think about I have 4 kids, so I'm like examining like, okay, do they
I'd be happy to
snore?
look at them anytime. Seriously.
That would be awesome. Yeah. I'm thinking of one in particular. I won't call them out, but lots of snoring, lots of just like mouth breathing, especially like just during the day. And they struggle with allergies. Mouth always just slightly open, lots of allergies, and so maybe I don't know if that's part of it or not, but like, what can I do to help?
So you need to start doing nasal hygiene right away. So I use the X Clear in my office, which is a saline xylitol mix. Okay. You start spraying his or her nose every single night. All your kids, everybody should be cleaning their nose. On occasion, kids with really bad congestion need a stronger decongestant. And Xclear does make a actual decongestant for ages 6 and older. The problem is you can't use it longer than 3 days or something, they say, because it's kind of like Afrin. Regular Xclear spray is a saline xylitol. It's fantastic. Start doing it immediately. Get the nasal strips, the intake dilation strips, the intake breathing strips right away, and do whatever you can do to help him be able to breathe through his nose. Okay. That is like step 1. Step 2, he's got to be seen by an airway dentist. Like, we've got to make sure that his tongue is not tied and that his palate is wide enough. Fly down and I'll do it myself. I have no problem doing it. The width between his molars at hair is such an important number. Like, we need to know what is that width, and then what can we do about it? How behind is the child, basically?
Yeah. Well, I guess I've outed him already, but he's, I only have one boy, so he's,
okay.
Yeah, he's, I think this is helpful for people, but it's certainly helpful for me. He's got like, he's had braces before. His teeth are always was very, very crooked. Okay. At a young age. And so he doesn't have them right now, but they're like, well, maybe he needs them again. And he's still kind of like, his teeth are like really big in his mouth and can't quite close his mouth a little bit. And so, so I'm like, okay, what can I do to,
So that tells me that his lower jaw is probably too far back. And the upper might look like it's too big or sticking out forward, when the problem is probably not so much the upper in like length, but the lower coming forward, which is so important. So that upper and lower jaw width and length is critical to know with him. So just knowing that, I suspect a tongue tie. I suspect that his arches are too small. Unfortunately, braces doesn't fix this. It doesn't. They will start lining teeth up, and knowing that he was so crowded that needed to be done tells me everything I need to know about his palate already, truly. So I've got some good connections for you where you guys are, definitely. Yeah. But at 10, with that kind of severity, I'm like, he probably needs custom expanders and all of that going forward.
Okay, so, great. Well, I'll hit you up after this and see what we can help me out.
Yeah.
On top of all this, I think, kind of pivoting a little bit, I think just with like all of the COVID-19 stuff, there's just this growing distrust with like the system of healthcare in general. And I think that's sort of bleeding over to dentistry a little bit for me. Like, I have this, even personally, I have this like growing distrust of like your typical dentist. Like, are they just trying to like get me to buy this next thing? Do I really need it? Do I really need the root canal, the braces, the expanders, because they think that's what like everyone typically does? What would you say to someone that had that opinion? Am I like far off? Should I be more trusting of my regular dentist?
You're not. Yeah, no, and I don't think so, because that trust is earned. And I teach this side of dentistry all over the United States, and I mentor an elite group of doctors. And I tell them constantly, like, your patients are never going to say yes to you as much as you have their best interest in mind and you have the tools that I have taught you to use, if you do not establish trust and rapport with that patient. And you guys as the consumers, you got to go with your gut. Like, if you walk in and the place is in disarray and things are kind of crazy, and then the doctor's in and out really quickly, not saying I haven't ever been in a hurry, that for sure, I'm sure that has happened checking on a patient who's might be listening to this, but you have to really trust that provider. And in dentistry, I mean, we were selling everybody Zoom whitening for a couple decades, and everybody's got to get their teeth whitened and all this stuff. And there always seemed to be this like pitch, right? That like, oh, you should try this or that. So when it comes to really truthfully healthcare needs and like the orthodontic approach that I'm talking about, there are very black and white numbers that we can present to the patients. Like, at 8 years old, your kid's upper jaw should be at least 35 millimeters wide. If it's not, we should probably do something about that, because it's probably going to turn into X, Y, or Z. But you have to go with your gut. And if you're feeling like they can't explain things well, that's another thing. Maybe they're not trained in it super well. You ask a question, you don't get like a solid answer, probably get a second opinion. That's what I would do. Before you do anything irreversible, especially a root canal, for crying out loud. Like, all of it, you want to make sure that you have found the person that has the best, really just at heart for you. And check Google reviews. Do it. I mean, see what other people are saying about the dentist too.
Is there specific type of dentist you should look for as opposed to just like going to your like local dentist office? Is there like, we've had integrative dentists on the show before. Is that like something you would think about?
100%. Yeah. So I did a ton of training in biologic dentistry before I became an airway dentist. I've had all these little like niches for me that all led me to this place that I am now. And I think if you have found a holistic and integrative dentist that is in your area, like absolutely go meet with them. The biggest, I think, deterrent for some of those offices is that the fees can be so high that it makes it difficult for the average family to go to. So I think calling, finding out what the exams cost and the cleanings cost, and making sure that, ask them some questions, especially surrounding airway. Like I'm going to talk specifically about airway. Like, does the doctor do any sort of habit corrector appliances on young kids? If that's a yes, they've taken airway courses. Like, because usually we're taught to wait till they're a teenager. For biologic dentistry, it's like, are they okay if I don't want fluoride? Or are they going to give me a hard time about it? I don't need anybody trying to educate me about fluoride. These are the things you guys can say on the phone. Or what is their stance on root canals and dental amalgam? Because that's a mercury filling, right? So those are some things that on the front end you could ask, and the staff's like, I don't know, let me put you on hold and go ask. Hang up. Because the whole team should be trained in it.
Okay, that's really, really helpful practical advice, because I mean those questions are just like what it's on everyone's mind. Like, what do I even do? So I want to ask you about a couple like one-off things that you've sort of mentioned, but I just want to ask you like your overall opinion. What about wisdom teeth? Am I supposed to get those removed? Because it feels like so full disclosure, I have all my wisdom teeth. And they don't cause any problems for me, but I feel like every time I go to the dentist, like, you need to get those out. And I'm like, why? And they're like, well, because they could get infected one day, and then, maybe you, and I'm like, okay.
Yeah. But like right now they're fine.
So yeah, I just don't know why do I need to get them out if they're not bothering me? They grew into my head. So what's your thoughts, opinions on just like wisdom teeth in general?
So I would prefer that we made all the kids wide enough that their wisdom teeth had room. But given that there's a whole generation of you and me walking around that didn't have that, I had mine taken out. Mine were sideways and totally impacted in the bone and really needed to come out surgically. And it was a horrific experience. I was so swollen. I hated it. But those of us that have them, then they've grown in. The issue with them, now yours can be perfectly straight. I have no idea. Send me a copy of your x-ray and I'll tell you. But they will grow in, and then they will be sideways. So if your wisdom tooth is butted up against your second molar like this, and it's actually exposed to your mouth, like it's not under the gums anymore, it's like this, and it's there, you're gonna get bacteria down there. And I have seen people lose both teeth because the wisdom tooth has infected this tooth, okay? Those are the times where I'm like, listen, it's super risky to leave it. I mean, I would just be really sad for you if you lost both these molars. But ultimately, it's up to you. If you were my dad, I would do it this way or that way, whatever. So that's where it gets tricky, because it's not just cookie cutter. I do not believe everybody needs their wisdom teeth out. Absolutely not. If they are fully erupted and you can floss them and keep them clean, they are yours forever. Like, just keep them, okay? That's kind of how I feel about it. Yeah.
That's helpful. What about people that have had root canals, or they've had like the amalgam, they've had like fillings with some like toxic stuff? What do they do if it's like they're just now like it's too late? Like, I already got them, now what?
Yeah, so we remove them safely. And there are very many integrative holistic dentists that will do the same. Like, you're on oxygen. I wore a respirator for years as I was taking these things out, because I got to protect myself and my assistants as well, right? It's not just like I'm doing this every single day for hours on end, So you should be offered basically just extra PPE. They should have fans and ventilation and stuff going. And if it's harming you and you want it out, then just make sure it's taken out safely, not just by whoever's the cheapest on the street.
Should you get, I've seen lots of different stuff. It feels like you can't do anything right anymore on social media. But one of the things related to root canals is like they could potentially be infected without you really even knowing.
Yes.
Would it be wise to just remove all root canals, or should you just get them checked?
So I prefer to check them with a 3D cone beam, and that's what we do in my office. It's really hard to tell somebody that they need all their root canals taken out when it could be 7 or 8 teeth. And then what are you doing? Okay. What if it's their front 2 teeth? Like, you have to put yourself as the doctor in their shoes of like, would I want my front 2 teeth removed? If there was infection in my jawbone, 1000%. And that's what I tell people, as long as they look good on our 3D cone beam, where I can rotate your entire tooth and check every root, you're okay, unless you're having systemic health issues. Otherwise, if there's large infection in the jaw, then we talk about proper removal and cleaning that out. Yeah. But it's not just like everybody gets it out.
Take them out. They're bad for you. Okay. Yeah. That's actually helpful, because I have talked to people that just say, yes, under no circumstances, you just need to get them out. And that's a good point. Like, many people have multiple root canals. And if they do, man, what could that mean? Yeah. I didn't even think about the front teeth. Yeah. That'd be brutal.
Yeah. Yeah.
Yeah. Do you want to add something?
No. I was just going to agree with you. Yeah. It's really hard. It's emotional to lose your teeth. It really is.
Yeah. I can imagine. Well, people used to put, I used to have a rapper friend, like a hip hop artist rapper, who had like gold teeth. He like had gold teeth caps over all his teeth, and then he took them off and they were all infected, and he had to like have them all pulled out and put, I guess, like ceramic implants in or something, and it cost so much money. He wasn't a great rapper, so it's not like he could easily afford it either.
Oh, man.
Everything
you do has consequences, basically. And that's what I tell people. The least amount of dentistry in your mouth, the better.
Last thing I wanted to ask you was about bedwetting. You have some content around bedwetting, and it has things to do with sleep apnea. Like, how those two things don't feel related at all. So can you explain how they might be related?
Yeah. So when you are bedwetting from underdeveloped jaws and sleep apnea, your child is in pretty dire straits when it comes to what's happening to their oxygen. And the way your body is designed, it's just intricately designed, right? So when you stop breathing in really severe circumstances, your body doesn't know if you're going to start breathing again. And it will start to pull oxygen from the tissues in your body that don't need it. And when oxygen is pulled from the bladder, a child can void, which means wet the bed. So they can start, I've had parents that are asking me like, well, what age is inappropriate for that? Like, when should we be worried about that? And usually it's if they're potty trained during the day, they should be able to hold it at night, is my general assessment. So by the time they're 8, 9, 10, 11, 12, I had somebody call the office that was 20. Now at that point, they've had everything checked. Like their bladder's been checked, the valves have been checked, and it's really, really rough. On the kids that I treat as teenagers that are bedwetters, they aren't going to church camp. They're not going out with friends. Like, it is a real imposition to their life. And I find massively underdeveloped jaws in these children. They all have the same story, maybe early braces, maybe no expander, ear infections, like mouth breathing. It's all very connected. So what I tell parents, we have literature to support that the tooth pillows that these kids wear can decrease bedwetting by it's 90% by 8 weeks, and it's 50% in 2 weeks. Now, that is a bell curve though, okay? And that's what I tell parents when they get their expectations really high. I'm like, your child's gonna fall somewhere on this bell curve. And it could take 6 months wearing it before it starts going down, but you'll suddenly have a dry night, or you'll have way less volume, and you'll start to incrementally make things better. The worse the nasal breathing, the longer it's going to take for that child to start getting relief, which is why the protocol when you're doing expanders and wearing a tooth pillow is to make sure that they're doing the nasal sprays every single night, sometimes twice per night, in order to help them to breathe through their nose and get that oxygen exchange back to normal. So it's kind of complicated and kind of in the weeds with how it happens, but it is absolutely, never did I think I would help a girl or boy stop bedwetting when I was in dental school. I mean, I work up here, and it is just one of the most rewarding things when you get something taken care of that is ultimately very simple to do.
Well, we appreciate the work you do. I mean, just hearing your passion for it, it's meaningful, and you're helping from little babies that'll never see you or never even knew you existed to teenagers wetting the bed. Wow, what an awesome testimony.
Thank you.
So you've said it all, but just like as a recap, let's do two like sort of different scenarios. So before we do the kid, let's just start with an adult. Okay, I think my partner kicks me. I might have sleep apnea. I wake up a couple times a night, sometimes feel unrested, whatever your typical case is.
Absolutely.
What should they do if they just got your regular dentist and they've never heard about any of this? What are some things they can do?
The first thing they should do is to work on their nasal breathing, get themselves one of those intake strips. Don't lip tape until you've had a sleep study, and then find an Airway dentist. They can DM me on Instagram. I try to help everybody I can. I get to it as quickly as I can of like, do you have somebody in this state or whatever, and I'll help.
Awesome. Okay, cool. So find Kalli and ask her is a good answer. Find someone that knows what they're doing and get somebody. Okay, and then let's say a parent, like we've got a kid that's maybe bedwetting, mouth open, etc. Very much like myself. What do I do?
So you've got to get your kid into a provider and let them be properly evaluated. So if you're in the Houston area, we're opening offices just as fast as we can. We're branded as the Airway Dentist. And what we didn't talk about is that I do have a virtual company called Tooth Pillow. I named it Tooth Pillow because that's what I do with Tooth Pillow.
Oh, nice.
Where your child can be screened virtually to see if they are for virtual care only. And usually on the older kids, we have to just deny because they need expanders and stuff that we talked about earlier. But if you're in Houston, you can come and see me, or you can go to toothpillow.com and see about a dentist in your area that can help you virtually as well.
That's really awesome. Kalli, is there anywhere online that we can hear more about you? Where can people find more?
Yes, you can learn more about me on my Instagram, which is the Airway Centered Dentist, all spelled out. And I have a lot of great content on my actual office websites, which is the Airway Dentists, plural, airwaydentists.com. And then there's a ton of effort going into our beautiful Tooth Pillow website as well. So those are 3 areas where you can get a ton of information. Yeah.
Very good. I'm going to link all those things in the show notes on YouTube and on Spotify, etc. So, Kalli, thank you so much for being on the show. This was amazing.
Thank you for your time. I appreciate you having me.